Hello, my name is Noelle Cummins, and today I will be discussing the importance of a sexual health curriculum in schools. Sexual encounters in life are inevitable, so why not teach our children about them? We teach our children how to handle bullies or properly mediate a fight with a friend, but we do not teach them how to properly handle a sexual encounter and what a sexual encounter could possibly entail. I am passionate about educating our youth, as I did not know what to do when I came across my first sexual encounter. However, since then, I have done research, talked to friends and trusted adults, and even therapists about what a proper sex education would entail. A sex education curriculum is essential in properly educating our youth due to the rising rates of early puberty and sexual encounters at a young age. I am not a trained professional, as I could never teach this course. But what I do know is that sex education is important, and I will tell you why right now. Sex education is physical education. We learn about the brain, so why not learn about our own and each other's reproductive organs? Our organs are a part of our bodies that are unavoidable, so we must know what to do with them and how they work and carry out processes within our bodies. Just like the rest of our organs, our reproductive organs affect our mental and emotional health. So to have a good grasp on our health, we must learn about our reproductive organs. So, why is there a stigma surrounding sexual health? So, according to the EBSCO-HOST database, some parents worry that if they acknowledge the topics of sex or sexuality with young people, it would lead to early sexual behavior. This is completely untrue, as sexual encounters, like I said before, are inevitable. So whether you teach your child about sexual encounters or not, they will most likely have one in their life. So basically, by teaching about a sexual encounter or sexual encounters in general, you could prepare a person and they will know if the encounter could be good or bad, and they will be able to decide if they are going to carry out this action or not. Sexual health has also been neglected to be taught for years. So this information is new for a lot of people. And typically, new information, obviously, is uncomfortable for people. When you discuss something that you're not familiar with, it is normal to be shocked when you're learning these new things. However, these new topics surrounding sexual health are important and we should know about them, because just like we would know about a mental illness, we should know about our sexual health, because it is there could be physical issues going on. So what does sexual health entail? According to the EBSCO-HOST database, sexual health, when viewed affirmatively, requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. Therefore, sexual health education is also about forming healthy relationships, learning about consent, learning how to set boundaries, and the difference between a red flag and a green flag in relationships. This also includes information on sexuality and contraceptives and knowledge of the male and female reproductive systems. If we do not know how each reproductive system works, we do not know how a baby forms. And part of sexual health is learning how a pregnancy properly begins and ends. Healthy relationships. It is important that we know what types of relationships we should have with our parents versus our peers, or our coaches versus our siblings. It is important to know when a relationship is healthy or unhealthy. Sexuality is also covered in sexual health curriculums, because it is important to know about every possible type of relationship that could exist, because a personable relationship, whether it is heterosexual or homosexual, there is sex involved in these relationships, and we must understand these relationships in order to understand the types of sex. Contraceptives are also important, because how effective would a contraceptive be if we don't know how to properly use it, or how it could negatively or positively affect the sexual experience or the person who is using that contraceptive? Consent, yes, it is a sensitive topic, but we teach our children from a young age that you shouldn't push people on the playground and you shouldn't let people push you on the playground. So we must teach our children that you cannot force yourself on anybody, and you also should not let anybody force themselves on you. And we must teach them how to properly maneuver those types of situations. And why is teaching about sexual health so important? As stated before, sex is inevitable. Teaching about sexual health can help prevent negative sexual experiences. According to the EBSCOhost database, once again, among teenage females aged 15 to 19, 42% had ever had sex, and among teen males, the percent was 44%. This means that by the time a graduating class in high school actually graduates, half of those children have most likely had sex. This doesn't even include possible sexual assault that doesn't involve penetration or oral sex. This only discusses the normal type of sex. The increase in adolescent sex should mean an increase in sexual health education amongst our youth. Because why would we allow our youth to be put into situations that they are not educated in? In conclusion, a sexual education curriculum implemented in a school education would allow children to learn about each other with each other. They would be able to ask each other questions, learn firsthand experiences, and possibly speak to physicians who would maybe be teaching this curriculum. Sexual health is physical health, and just like we learn about the brain and the heart, we must learn about our reproductive health and the importance of healthy relationships in our lives, because a healthy relationship can drastically improve a person's life, and an unhealthy relationship could drastically ruin a person's life. Thank you so much for your time, and please continue to fight for the widespread sexual education curriculum.